We're here to talk about a very important issue on how we are focusing on meeting the needs and creating opportunities for the residents that we serve. We've gotten a historic investment from our federal government. Using those funds, you're going to see some very promising approaches and things that we've done in our counties to really make a difference. And so I'm joined by some of my esteemed colleagues who are going to show you that counties didn't have to get ready, we stay ready. And with this pandemic that has happened and has confronted us, we were able to deliver on rental assistance, food, dealing with small business grants, help with roads, with bridges, with water infrastructure projects, dealing with the mental health issues that we may face, the substance abuse, opioid, and things of that nature. But this has really been a trying time for us as counties, but you're going to see some great examples of where we are. We are focused, like I said, on understanding our urgent and acute care needs. Our nation's the largest localities have budgeted over 100% of the total available recovery funds from the first tranche. Small localities have obligated 3/4 of their first tranche. Counties are pursuing thoughtful approaches to deploying the American Rescue Plan resources and ensuring a coordination to our state and local partners. NACO has teamed up with the Brookings Metro to track and report on the local approaches, and here this is a great reading material which highlights a lot of our counties and where we are. We are leading the nation in the recovery through strategic investments that you're going to hear about today.
The American Rescue Plan presented all of us with an opportunity in the midst of a life-changing period in our lives. And in our communities, these ARPA funds provided county leaders with an opportunity to make an immediate impact on families, businesses, and critical network of nonprofit agencies that made such a difference during a peak months of the pandemic. While counties were allowed some discretion in how the monies could be spent, our board was unanimous in our approach to the first half of our ARPA dollars. We knew getting that money back into our communities through a grant process would help save small businesses, continue critical testing and vaccination clinics, and ensure that our families could stay in their homes.
We're proud to announce our latest signature American Rescue Plan initiative that addresses a problem too many people across this country, especially people of color, young people, and people with disabilities, are encountering: medical debt. Across the country, people are struggling. They have bills they can't pay because they welcomed a new baby. They got diagnostic tests after worrying about news from their doctor, or they were rushed to an emergency room after an accident. Medical debt is the number one reason that people in this country declare bankruptcy, the number one reason. So we decided to forgive as much debt as we could. We're partnering with a nonprofit expert in this space, RIP Medical Debt. RIP Medical Debt is a national not-for-profit that has forgiven close to $3 billion in debt in the United States so far. This fall, with just $12 million of our federal funds, our partner will negotiate the purchase of hundreds of millions of dollars in medical debt for Cook County residents and forgive it. We believe this will help people get medical treatment because they won't be worried about their past debts. Additionally, we'll work to ensure credit agencies are contacted to remove the debt from credit records, positively impacting credit scores. Improved credit scores will enable our residents to take advantage of loans and mortgages. Families can reconsider plans for higher education. People can build back their emergency savings to prepare for the future. Families, finances, and futures can be changed by giving people a chance to clear up their debt.
Among the efforts that we created was Project SAVE, which included our Promotora Engagement Program, which is a program from the community, people from the community providing services for the community. Vaccination walk-up sites without appointments. Everybody thought it wasn't going to work, and it did. And expansions of our information hotline to support vaccine appointments in various languages to make sure that our communities were having access. We have made sure we addressed longstanding disparities and supported our struggling residents by making investments in housing and transportation. We created a $4 million security deposit program to make sure our residents were not left unsheltered. We invested over $5 million in funding to assist small landlords who were experiencing significant rental payment shortfalls. And additionally, our board secured hotel rooms for thousands of individuals who required isolation due to COVID-19 and people experiencing homelessness. Families in San Diego County, just like thousands around the nation, were economically impacted by the pandemic. And what we did was to make sure that everyone, one less financial burden for the residents, was to make sure that we helped advance recovery. Our board allocated another $1.5 million in funding for a pilot program to ensure that our students, anyone 18 and younger, was going to be able to get free transit passes. We needed people to be able to get back to their schools and to where they needed to go. It actually has increased ridership by 75%, so we're excited about the pilot program and continue to use these resources moving forward. In addition to these investments, we allocated funding to support small businesses, address food insecurity, and support students' mental health, among other programs.
In the middle of the pandemic, we knew right away that connectivity, the lack of broadband, high-speed internet, was critical across the country to so many, really to every county in America. We created a broadband task force at NACO. We began to work immediately. I took what I was learning back to Boone County in December of 2020, and we began to put together our program with the anticipation that there would be funding coming our way to be able to help impact and install this program. So as we moved quickly, we began our RFPs according to federal procedure, knowing it would be federal money, and we were ready to hit the ground running quickly. I say this to let you know that the investments that we're making in our community, they moved quick. And they moved quick because of the direct allocation of funding to each county. Direct allocation was something we believe strongly in. We know that funds that travel from the federal government to state governments and then down to cities and counties, that is the norm. But we didn't want this to be the norm. We needed to act quickly, and we did. Our investments in Boone County in broadband are well underway. Many of our residents are already benefiting from the high-speed fiber to every door in Boone County. Our project, countywide, is a $42 million project to over 40,000 homes, will be finished by March of 2023. So yes, thank you.
The board has already allocated $1.6 million out to our community service organizations, specifically with the intent to aid in the recovery of the pandemic. Some of these awards were granted to our local crisis hotline so they could make resources available bilingually because we have such a high population of Spanish-speaking residents. We also made a significant contribution to the Hunger Coalition because another right out of the gate impact that our county residents were feeling was food insecurity. So the Hunger Coalition has awarded or given out food to an unprecedented number of families throughout this pandemic. We also have awarded money to the Peekaboo Water System, a small rural water system within Blaine County to help with clean and healthy drinking water. And also funding has gone to the Blaine County Housing Authority. One of the most significant impacts we have felt, like much of the county, is an increase in housing insecurity. We have seen remarkable property value increases, and that has caused an influx of new residents moving into Blaine County and has caused a lot of our service industry to suffer from housing insecurity. So the Blaine County Housing Authority and our partnership with them has been critical to assisting and ease those housing burdens.
We had a brand new program, the Emergency Rental Assistance Program. If there was something that was highly ambitious, it was the idea that we would start a national infrastructure from scratch, and that within 7 or 8 months, by the time the moratorium ended, there'd be enough happening that we'd be able to prevent what some people thought would be a tsunami of evictions. In the 10 months since the moratorium ended, not only did evictions not double or triple, they're actually still, after 10 months, at 30% below historic levels. Now, all sorts of problems that need to be fixed and done better the next time. But this is the most significant policy in preventing eviction ever. Not in the New Deal, not in the Great Society. This has been done, and these county leaders behind me, they were asked to start that up literally from scratch, and it was a tough start, but it got out there, and it's helped over 6 million renters and their families avoid evictions. I think one of the vital innovations of the American Rescue Plan was that $65 billion went directly to county governments, that they did not have to go through their states or through their legislators. And the fact that they were able to get those funds quickly meant that we saw county leaders across this country rallying their communities to find out what was the most important things they could address with American Rescue Plans. And because the funds came quickly to them, and because there were 2 tranches, they've been able to map out serious plans, both to get out of the pandemic in 2021, but then to start building a strong recovery. And we've seen these in areas like affordable housing, dealing with homelessness. We've seen a lot of it in violence prevention and public safety and law enforcement. We've seen a lot in helping young people deal with learning loss and mental health challenges that have come out. And then small business, being able to, counties know the particular needs and hits of their local business community. And rather than just a lot of our great entrepreneurs just lose their jobs, lose everything at no fault of their own because of the pandemic, they've helped provide a lot of support to keep child care centers, to keep small businesses in business, and for those who had to turn down, to get that second chance to come back with a new business to help revitalize those counties and create new jobs in those counties.
Our county residents very much benefited from our ARPA funding. This was so critical and important. Our communities were one of the hardest hits, particularly our communities of color and our Latino community. If it wasn't for ARPA funding, we wouldn't have had the resources that we needed to ensure that people had the access to the vaccines. We were able to create vaccination sites. We were able to make sure that our communities had rental assistance. We made sure that our communities had access and funding for funeral services and also services for mental health and homelessness. And so what ARPA funding did for us was to make sure that it reinvested in our communities in a very difficult time. Our vaccination program, specifically in the Latino community, was very intentional about meeting people where they were at. We made sure that we created these super stations in partnership with local healthcare partners, and we were able to provide resources with promotora programs and health navigators, go door to door. We made sure that all of the information was in language, and as a result, over 98% of my community was fully vaccinated.
Our county has used the federal funding to help with so many things in the county. We do the mental health. We also are using the money for vaccines and different things. So we've used it in several different ways.
Our residents benefited in the area of public health, specifically, making sure we're a very rural community. So it's very challenging. We're an agricultural area, and so from a financial standpoint, the people that can least afford the very significant challenges that COVID presented. And so making sure that we were able to get those services out into the community. We bought a mobile medical truck to get out into those rural communities to make sure that those that couldn't get to us, we could get to them and provide those services.
Our citizens benefited by getting their shots, by having a special county area to get their shots at. And so it really helped the citizens across our county doing that.
Our county has put a large amount of that money into buying the equipment to respond to the pandemic itself, and then to the extenuating circumstances following the pandemics, after the pandemics. But we've also realized the importance of telemedicine, so we've invested some of that money into the final mile extension of broadband with high-speed fiber to every home in the county, and that project should be complete we hope by the middle to end of 2024. And without those funds, we coupled with money from our state, we would have not been able to do that for a long time. Telemedicine is important, and the broadband expansion to people who are shut in or people who live in more remote areas. Our county is 854 square miles. There are parts of it that are very suburban and urban, and there are parts of it that are extremely rural and are in mountainous areas. So it's difficult for some people to be able to get out to see a routine doctor. Plus, with the change of medicine, doctors aren't as available as they used to be, so telemedicine is becoming more and more a part of our lives, and it's an important thing. So if we can have that for our citizens, it certainly helps our paramedics. We also, with our public safety people, are using what we call paramedicine, and our paramedics will go out and routinely visit with people and do COVID testing and actually administer vaccines and this sort of things as a result of the federal ARPA money.
Our county residents have benefited from the ARPA funds for behavioral health. Much of the ARPA funds went to the behavioral health internally. People have really life-changing experience where they've lost their jobs, children couldn't go to school, people couldn't get their a babysitter just to go to work, and some people lost their jobs, and just really a whole slew of things that really traumatize the family, children, and the community. So that's where these ARPA funds are going to really, and are already, our residents are benefiting from these dollars for behavioral health, mental health, even in our courts.
Our county residents has benefited from the money in several ways. From the start, we made an emphasis on mental health, and we allocated a proportionate amount of money to each commissioner's districts to address not only the countywide needs but specific interests in each district. So we've had a range of things from definitely public health to health care, to mental health programs, economic development, specifically to try to bring some jobs back in the distressed districts. We focus some things on increasing mental health services in juvenile justice to try to increase our programming in that respect and keep kids out. So right now we have a plan right now that we're looking through for a remainder of those funds to try to enhance our step-up efforts. For years we've been a part of the step-up program, and we're doing a study now to analyze if we're going to expand our community mental health services and take a lot of the mentally ill out of our jails. So that's what we're planning with the money, and hopefully in the long run it will benefit not only the citizens but save us some money in regards to people sitting in jails that have mental health issues.
Well, Lubbock County residents are benefiting from ARPA in a variety of ways. But one of the things that I'm the most proud of is that we have partnered with our city, the city of Lubbock, in creating and building a new diversion center for mental health. Now, we call it a diversion center, but really what it is, it's a emergency room for mental health. And so we're dealing with mental health issues of the community, we're dealing with homeless issues of the community, and it's an opportunity for them to come to find a central place to get the services in the community that they're looking for.
Every community in the United States, regardless of where they are and what size they are, urban, suburban, or rural, have been dealing with the issues associated with mental health, addiction problems, opiate addiction issues. My county's been no different than others. We have a very strong task force working with our county government, our not-for-profit providers, and others to address the issues of opiate addiction. It's an ever-changing type of problem. It's not the same as it was a few years ago when it was an issue regarding heroin addiction. Now it's related to fentanyl and fake pills. So what we have to do is, and we have done, is take the federal dollars that we've received, as well as additional assistance from New York State and our own dollars, and are putting them in types of programs that vary. I like to think of treating and attacking the opiate epidemic is similar to what FDR did to address the Great Depression. He threw everything at the wall, all kinds of programs, saw what stuck. If it stuck, continue with it. If it didn't, try something new. And that's exactly what we've done, from interdiction of drugs on the street to assisting individuals receive the treatment programs that they need. Addiction is a disease. It can be overcome, but it takes a lot of hard work by many people. And that's what county governments do, is we're right on the front lines of addressing it by being one of the key partners to ensure that our communities have the resources they need and put them in the programs that matter.
Our county residents have benefited from the federal dollars because we've invested in our mental health system. We recognized that there was a gap in our coverage, and that gap was too many people with mental illnesses in our county jail and no place else to put them. So we stood up a jail diversion center with those dollars, and it's working extremely well for us.
Oh, in the very beginning of the pandemic, we were looking at over 60% of our residents being evicted out of their homes. So just the very fact that we were able to provide rental assistance and even mortgage assistance to a lot of our residents, we're able to keep people off the streets and being homeless.
Our county residents benefit from the American Rescue Plan Act funds through one of our projects called Project Reset. This project was an eviction prevention program. Thus far, utilizing those funds, we have made sure that over 17,000 residents of Gwinnett County have remained stably housed, and they were not evicted. This is huge for us, and we did so well. We were also selected to be on one of President Biden's top 10 counties that was performing with the American Rescue Plan Act, and we're very proud of that.
Our county residents have benefited from the federal funds in a number of ways. One of the things we were able to do is to fund a lot of the nonprofit organizations that we hadn't been able to fund before. And so by doing that, we have an opportunity to broaden the services offered by the county. Well, one of the nonprofits that we fund is a housing programs for formerly incarcerated people who have difficulty renting or getting a lease from a landlord. And so by funding this particular organization, we're able to help them find housing.
Essential to everything during COVID is vaccinations, but most important is keeping people in a stable home environment. And when they lose their incomes, have it substantially reduced because jobs are diminished or closed is critical. So the federal assistance to stabilize people in their homes was critical.
Our county residents are benefiting from federal funds because we're using them for public housing. We're building more affordable housing, and we're also working on vaccine distribution and booster distribution. But we also have worked on our DEI efforts, and of course everyone benefits from robust public safety and fully staffed public safety. So we're using some of our federal funds with our EMS and EMT to help recruit diverse firefighters, females, people of color, so that we can have fully staffed, compassionate, relatable public safety staff in our county.
Our county residents have benefited from the federal funds by having increased access to housing stock. We've increased our housing stock by over $90 million, and we're doing that for the residents of Hennepin County.
The rescue funds in Audrain County, our citizens have benefited because we have taken and partnered with the local cities and municipalities to have a program for workforce housing infrastructure. So we were able to take a lot of that money and put it right into the infrastructure of the municipalities and the county to benefit people for cost-effective housing.
Our county residents benefited from the federal money to keep them from becoming homeless from severe number of evictions. So we used our $200 million in ARPA funding to do a rental assistance program and many other programs to serve our communities in Fulton County, Georgia.
The need for housing in our county is critical. We have more people that work in Berkeley County that live outside of Berkeley County because there's no housing available to them. And so we're missing out, and our employees, are the citizens that work in the county are missing out.
We are spending most of our ARPA dollars into housing. And because we have huge housing needs, and so 40% of our dollars are going into that. We also are putting resources into violence prevention and also workforce solutions. So we're creating opportunities to create more nurses, community health workers, childcare workers, because this will all help our economy, and it will help our residents to thrive.
Our county has benefited from the ARPA funds through our Connect program, which we have helped thousands and thousands of people in our county through connecting them to services for navigation, for mental health, for housing, for jobs.
In Sonoma County, our residents have benefited directly from ARPA funds. Two examples. Number one is we've been able to fix infrastructure for the future of public health with a new public health lab. And on the other side, we've invested directly in community. We've invested in equity. We've invested in groups to make sure that we never go back to those dark days of having the most underserved be the most impacted.
Our county residents have benefited from the federal funds by being able to receive safe and healthy meals in their homes for seniors and those were unable to get out during the COVID pandemic. And it's been a great way to connect the community with healthy and nutritious food.
Our county residents benefited from our investment of federal funds throughout human services, and everything from our investment to our Ronald McDonald House to one of our nonprofits that does 2-gen work, whole family work. That's something that NACO's been working on for a long time. So we're investing the dollars where it really is going to make a difference in our community.
Aloha, I'm Kipukai Kuali'i from the county of Kauai. Our citizens of Kauai have benefited from federal dollars with some of the investments that our county has made. We had a nonprofit recovery grant program. We've supported our kupuna programs, or our senior programs, and then our youth adolescent drug treatment center, and of course housing and houselessness. I know we put $2.5 million to permanent supportive housing, transitional housing. So a lot of good things are happening, and more to come.
Our county residents have benefited from the federal funds for workforce development and helping retrain. We have a mine that's closing down, so we're going to retrain those workers. We've got to get some more skills for growing the virtual economy. And those are two areas that our county is benefiting.
Our county residents have definitely benefited from the federal funding. We're working on a number of initiatives of a collaborative effort of bringing our philanthropic, our corporations, our nonprofit and government entities together to address issues such as daycare, transportation, and workforce affordable housing.
Our county residents have benefited from the use of federal funds for workforce development in a unique way. You know, we're in the Florida Keys. We are the little tail at the end of the state of Florida. We're 43 different islands connected by bridges, 120 miles linear. Truly a tourist driven economy, and when COVID hit, we really had to reinvent how we were going to derive our funds, and we found a lot of people ended up moving back into the Florida Keys, into their second homes, because they could work remotely. So we've used some of the monies that we received to help do internships and help to teach other people how they too could work from home and remotely and not always be tourist driven.
Our county residents in Pitt County, North Carolina, benefited from the federal funds by partnering with agencies and businesses that can train non-development people. I'm from an area that's highly minority and poverty, and the young people have nothing to do, so they're having the opportunity to get a job, learn how to work, show up on time, and that's being done by our partners. So it's partnership that makes a difference with federal funds, and we can hire someone and start them on our economic way.
Our county residents have benefited from the federal workforce dollars by actually us providing business loans to businesses that are out there in order so that they could keep their employees and keep them going through the pandemic. It's been a great incentive for them. We have also used those federal dollars to do job training for those people that lost their jobs during COVID, and currently we're using it for those people that need to increase their skill sets in order to get the jobs that are out there in this market.
The federal funds have been able to help us and help people find jobs through the partnership that we as a county and local government has and have with the state of Montana, Department of Commerce, the governor's office, and so we work in conjunction with the state in those programs.
Our county residents benefited by ARP for many reasons, but the two major factors that I saw is really reinvesting back into the tourism and the economic growth that we're going to see as we come out of the pandemic. I think that's one of the things that really kind of stresses is that we need to bring our community back together, and there's no better way to do that than investment. The other part was really about through the community health and service programs that we have. We're really investing back in our foster care system, really investing into an opportunity to have our communities come together through our community coalitions, and I think that's where we're really starting to see as we work together to overcome the pandemic.
In my county, there's only 1.1% of the land mass that's taxable. The rest of the 10,000 square acres in my county is not. It's all federal land. So that creates a burden for us. But the ARPA funds, the federal funding, has covered our sheriff's department now for this year, and it will cover it for last year and this year. The last 2 years, our residents have benefited from a fully staffed sheriff's department. They have a lot of mileage to cover, a lot of country to cover, the 10,000 square miles that they cover, and one U.S. highway and one state route highway that they work, plus the communities, the 5 communities in my county. And so, yes, the fully staffed, they're spread wide and far in our county, and being able to be fully staffed for the last 2 years has been an extreme benefit from the federal funds.
Our county residents benefited from the American Rescue Plan dollars by our direct investment in small business. We kept people at work, we kept people from losing their jobs, we kept people in their homes and apartments, we kept people in businesses from going under, and we kept residents paid, and we kept dollars in people's pockets.
Our county residents have benefited from the ARPA funding in multiple ways. One that's really important to my district, specifically in Cook County, is the small business initiatives that have helped small businesses in the 36 municipalities that I represent. This is critical because many of the small businesses don't have the technical assistance that was needed in order to access the funding. Cook County has put technical advisors in place to help with how to allocate the funds, what to do with it, how to expand their businesses, not only just stay in business, but some of the businesses are looking at expansion as well. This helps all of Cook County as a whole because the 129 municipalities outside of the city of Chicago need extra help, especially from a small business perspective, not only because of where they're located, but because how they fit into the whole structure of Cook County as a whole.
We use part of our funds for small businesses because they were greatly hurt. We in Santa Cruz County were affected differently than a lot of places throughout the nation because our border was shut. So our small businesses were greatly affected because people that normally shop in Santa Cruz County weren't able to come across from Mexico and shop. So we lost a lot of funds, and our small businesses were hurt throughout the pandemic. So these ARPA funds that we are distributing are greatly going to help these small businesses.
Our county residents have benefited from the ARPA funds directly by us giving out small business loans so that our small businesses are able to stay open and continue to serve our community. It's been really exciting to see our restaurants be open and growing because of the efforts that we've made.
One of the initiatives that we did have in our particular county is provide grants for some of our businesses that were actually in the brink of closing. So great opportunity to keep those businesses moving on and continue to drive the economic opportunities and the economic impact for all the citizens of our county. So thank you.
our county residents have benefited from the dollars coming from the federal government through our rural areas. Also, we've looked at our water. We've been able to upgrade it, and also we have looked at broadband. That's one of the areas where we have found weak out in the county areas. So water and broadband has been the two areas where we have put the most money at this point.
Our residents benefited from our federal funds as it relates to transportation. It is so important that we provide an opportunity for those who are seeking work, those who are unemployed, to make sure that we have adequate transportation in Memphis and Shelby County. And so that's where we're using federal funds, is to deal with our infrastructure in terms of matter, providing adequate transportation to and from work, and making sure that we're increasing our bus routes in order for people to get to work.
Our county residents benefited from the $9.5 million that we received in ARPA funds, primarily through improved public safety efforts within our county, both to our sheriff's department and our local firefighting community. In addition to that, we addressed a number of needs within our communications network to ensure that we have the ability to communicate by those entities, the sheriff department and the fire department, throughout our county where we lack those services. So that's directly how our county residents have benefited from the use of those funds.
Our county residents benefited from the ARPA funds by really infrastructure improvements. We are a growing county. We need more housing, but we lack infrastructure and roads, so that's something that we used our ARPA funds for.
Our county residents have benefited from the ARPA funds in numerous ways, but one specific way is the expansion of infrastructure and utilities, such as water and sewer projects. Currently, we're building a $12 million water treatment plant in Newtonsville, Ohio, an area that was unsewered prior to the ARPA funds availability. And at the end of it, it will have extended sewer to an area that can prosper by economic development that did not have that opportunity before.
Our county residents are going to benefit from the ARPA funds in many ways. First of all, we're putting in the middle mile using a company called Allo, and we're going to own that middle mile for wireless internet, and it's going in the ground right now with our ARPA funds. And we also got some grants from the state to supplement it, but all of Yuma County will have access to high-speed internet because of the ARPA funds, which we would have never been able to do before. And the community of Tacna gets a brand new water system, which their water had arsenic in it, and it was a terrible, outdated, very old system. And we've just, and the ARPA funds are going to help fund the Tacna water system, which is a rural part of Yuma County. So those are two examples of how our ARPA funds are being used. Also, in the community of Somerton, they're putting in sewer and roads into an area that has long been in need of those sewers and improvement on their roads. So that's another way that the ARPA funds will be helping the Yuma community.
We just finished allocating about $13.3 million. We used about 6 of it so far for water and sewer districts to help the small communities across our county become compliant with water and sewer problems. We also put out about $5 million into nonprofits to help them. So it's going to be a great opportunity to improve our overall quality of life throughout the county.
Our county residents benefited by the federal monies there, the ARPA funds. Our county has over 70% public lands, and currently we've got a volunteer ambulance service, and it got to a point during the COVID years there that just had issues of trying to get volunteers, and we were able to go to a full-time service through a contract with another company. And in that point in time, we needed to look at ambulance bay for them that had housing and everything. And so that's where a good portion of the ambulance funds will be going. We're right in the middle of working on a contract on a purchase of a property, and that the residents can rely on ambulance services, that there'll be adequate times for them, the ambulance, to show up and at least get them in a timely manner to a hospital in the time of need. So that's been a big deal for us, and just trying to get that finished up right now as we speak.
Very good. What would you like people to know about the importance of county government?
The importance of county government is that those that are in county government, they need to be involved in everything that's going on. In our case, like I said, we had a lot of public lands, so that's a lot of the reasons why we're involved in NACO, but they're in the public at the local level. It's important to have that one-on-one dialogue with the constituents, and as going forward, you listen to what they have to say, but the one thing I've always said is that you can't please everybody, and if you're trying to please everybody, you're not doing the job as a commissioner.
Our county residents have benefited from the ARPA money through infrastructure, through better water. We've worked on that, through broadband to help with internet, especially for our schools and our students that live in rural areas that didn't have internet, to help them do their schoolwork when they were out during the pandemic. It's been very beneficial in all of the rural areas and the big cities in Arkansas.
We here at NACO are announcing the Center for Resources for the Opioid Settlement. Right now, counties are going to be seeing opioid settlement dollars in a lot of cases. Maybe their states are going to be receiving dollars that will trickle down to counties. This is going to be a great center of best practices, a great place for frequently asked questions, the FAQs about how can I use this money, what is the permitted purpose of it, and other best practice cases from around the nation. We'll find counties that are really doing an exemplary job of using these dollars in the right place at the right time, and we want other counties to be aware of it and be able to take it back to their home. 6 years ago, we at NACO began the work of our task force. NACO and the National League of Cities, 10 county officials, 10 city officials, worked together to create our opioid drug policy that you see today. Much has happened since then. I was the co-chair on behalf of counties with the mayor of Little Rock, Arkansas. We developed the recommendations, again, that you see as we address substance use disorders and the crisis. Since then, we've made great strides in our work and our accomplishments, and with the challenges made worse by the pandemic, we're here today. Fortunately, we have a new tool in our toolbox with the opioid legal settlements and the new resources from our state and federal partners. We are pleased to welcome today a speaker who understands counties because he once served at the local level.
You know, as a former state health official and a former local health official, somebody who's worked at the county level for several years, I truly value the role of community-based work and everyone that works towards that. So the work that you are doing to improve substance use services within your counties is so important that I've seen it firsthand. You know, when I began my work in county government, especially where rubber meets the road every single day, and you get to see what the challenges are, and there are no experts there. You've got to make it happen, and you've got to make it happen immediately because people's lives and futures depend on it, so thank you. You know, President Biden has been clear from day one that the overdose crisis is an urgent priority for this administration. He has called for all of us to work together to reduce overdoses and save lives. And now we've got a bold plan to accomplish just that. It's important because, you know, just last April, President Biden sent his administration's inaugural drug control strategy to Congress. Why that is important is because this strategy is being rolled out at a time when drug overdoses have taken a heartbreaking toll across states, and you know that. We've lost over 107,000 lives in 1 year, period ending in 2022, January. Now think about that. These are people you know, families, communities, neighbors, school teachers, kids, and we're losing an American life every 5 minutes around the clock.
America's 3,069 counties, we want to be a partner, we want to be a resource to you, and we look forward to that. And we do appreciate you being here today. You also heard us talk about today that the Coming months are going to be quite exciting. Today and tomorrow, we're going to be rolling out the new center that will work with all of us counties to help with the opioid settlement funds that are starting to flow, ARPA dollars that can be used, better understanding how we can leverage those dollars together. The Opioid Solution Center is now on the NACO website. It's a repository of practical tools. It's got templates, case examples, and connections to free technical assistance curated for counties. The resource will focus on what you need to make sure that you're dealing within the approved uses from the opioid settlement funds. We'll also update and add information in the coming months as that unravels. This fall, NACO's going to we're going to launch a new Opioid Solutions Leadership Network. And this is important. We want you to be involved. An intensive learning and leadership building community for county leaders focused on reducing overdose deaths and addressing substance use disorders in your counties, your communities. Applications to join this network will be open in September. Please pay attention and watch for that. We appreciate our partners at Arnold Ventures and the Pew Charitable Trust for supporting this initiative. And our state association partners, let's not forget them. They've been instrumental in crafting and implementing this new effort. To learn more about the role counties played in securing funding from the opioid litigation settlements, please be sure to join our center launch workshop tomorrow at 10:30. Here at this conference, tomorrow at 10:30, more going in depth about this. Celebrating county opioid litigation wins and planning for what's next. We hope you'll be there. Again, Dr. Gupta, thank you for your generosity of your time. We had some good discussions today. West Virginia, Kentucky, but it parallels what you're dealing with in your communities. And this is going to be a great resource for all of us. We're so excited you are where you are, and we want to work with you.
Thank you, Judge. It's a pleasure to be here at NACO. Thank you very much.
As someone who served on the National Association of Counties, National League of Cities, Opiate Addiction Task Force a number of years ago, I really commend NACO for this new Opiate Resource Center. It is going to provide counties, regardless of where they are, the resources that they need so they can find out what are the best practices that are going on in the United States. I've always found out when we come to our conferences here, I try to steal the best ideas elsewhere. And that's exactly what this Resource Center is going to do. It's going to put together the resources from across the United States and let the counties and other governments truthfully understand what's being done, the best practices in the field, so to speak, so that they could be replicated elsewhere. It's going to be a tremendous asset that all of our more than 3,000 counties are going to be able to take advantage of.
We're so excited at NACO about this historic opportunity to really transform our counties with the opioid settlement dollars that we're going to receive through these settlements that are happening all over the country. We have the huge opioid crisis in our counties where we're dealing with people that have dealing with overdose and dealing with the abuse that they're suffering. And so we are very excited that we're going to create this solution center where counties can come together and learn what other counties are doing with their opioid settlement dollars.
It's going to be a big help for all counties. We've been dealing with it from the very beginning. And some other organizations don't realize that we've been in it from the very beginning, and so it just gives us another resource and experiences from other counties and groups that have fought the same thing.
I think the issue is serious in every area. It's been proven over and over that's the number one cause of our jail populations, mental health. Everything is involved around that opioid situation. So the opioid is the situation is critical, and I'm certainly glad that NACO is taking a stance.
It's just another one of the massive tools that NACO provides for all of its members. This is a huge problem, and most counties don't know yet how much money they're going to get, how to deploy it in the best fashion. So these kind of resources that NACO puts together for us are really a godsend so that we spend this money well.
This coming Veterans Day, NACO and NAC VSO
are joining forces to highlight the critical role that counties and veteran service officers play by launching Operation Greenlight for Veterans nationwide. This effort is inspired by the statewide campaign conducted by New York State Association of Counties, the New York State County Veteran Service Officer Association, and the New York State County Executives Association. Inspired by their model, we are inviting all of America's counties, boroughs, and parishes to participate in Operation Greenlight this fall by lighting up one or more municipal buildings in green from November 7th to November 13th. By shining a green light, you'll let former service members know they are remembered, they are seen, and they are supported.
The Green Light Initiative, and basically it is to recognize veterans through opportunities for people to actually put green light bulbs in their courthouses and hopefully get their residents and constituents to do the same, like on a front porch or in a living room area, to be visible through Veterans Week.
Well, as a veteran of the United States Marine Corps, I think we have to give our veterans everything they deserve. So I'm in full support of our veterans.
I come from Montana. We have a disproportionate number of veterans, both in terms of the number of people from Montana who enlist and the number of veterans who retire there. So this is just going to be a great way to show our appreciation for their years of service, appreciation for them being in the community. And it's a simple little thing we can all do, just put in green light bulbs for a day.
And faithfully serve and protect the interests of America's counties, so help me God.
I feel like congratulating Logan also, because she's standing there smiling. Congratulations, my president. God bless you. And thank you, Lisa. Thank you.
It is exciting to be here as the second woman of color to lead this organization. In its 87-year history, I'm only the second. I'm not the first, and I'm not the only, though. So those are two burdens I don't carry. But I look forward to carrying the burden of advocating for the counties, because I don't see that as a burden. That is an opportunity for me to put forward the needs and wishes and priorities of the 3,069 counties that make up the NACO organization.
Tell us about RISE.
RISE is my initiative going forward, and I took that borrowing on the initiative of Larry Johnson. His was Thrive, mine is RISE. So I'm looking for resiliency, inclusion, solvency, and empowerment. And so I want people to be able to withstand, to grow, to develop. I want to include everybody at the table, regardless of where they are in their lives. I want for people to have solvency, especially women, raising children, to have financial solvency, security, to know how money operates and to be able to work with that. And I want to empower. People need the chance to, wherever they are in life, to be able to grow, to learn, to move forward, to be situated to have other positions. And then we need to tell that story. That is the exclamation point. That's telling the story so that those who are not a part of it yet can hear the story and understand that there's an opportunity for them as well, that they can replicate this process and rise, that they can, in the words of Maya Angelou, still rise.
We cast 4 votes for James Gore and 1 abstention.
So congratulations to James Gore, our second vice president for NACO. Please join us on the stage. Come on up from California.
You know, I'm excited for the organization. I'm excited for our country because this is where it's happening. You know, the breakdown of democracy out in the federal level and out in the world is not happening here, where we have to deliver for constituents. And that's really what resonates with me each and every day. It doesn't matter north, south, east, west, rural, urban, suburban, wherever you're from, you got to deliver locally all the time. And so these are the public servants that I admire, and I'm just proud to champion them.
county commissioners, we shop in the same grocery store with our constituents. We go to the same parks. We worship in the same areas. And so we're around everyday people. And being around everyday people, you get a chance to connect with them in ways that other folks may not be able to. And that's why we'll continue to be that frontline response to make sure that we're building capacity through rent, through food, through wellness, to make a difference in our community.
We are the social safety net for everybody, and we make sure the roads and infrastructure is in place. We make sure that our communities work and run.
Value county government is where the rubber hits the road. We're the ones that have to implement all those services that often taxpayers and citizens take for granted, of good roads, good bridges, infrastructures, park, recreation, and just a good overall quality of life for our citizens.
Our residents benefit from county government through all the services that we provide, everything from our sheriff department to our court systems to our road and bridges, you name it, the county touches it.
Making sure that the basic services that I think everyone depends on, whether you're wealthy or whether you're in the most challenged position, whether you're a child or an adult, that we get those services that people are dependent on, and very proud of that.
Local government is what drives this country. It should not be the other way around. I mean, we are the ones that see the people in the grocery stores, on the streets every day. And as we start to move forward, and we got to do that collectively, I think counties have the greatest opportunity to lead.
Your local government are really your connection to federal and state government, and most of your elected leaders are just people that are trying to do a better job for our communities, and we are real people that also really want to help solve problems.
Local government is close to the people, and particularly for the last 2 years of the pandemics, the county governments have been on the front line more than anything with public health, the public safety elements. So there are a lot of things that counties saw during this 2-year period, and I think we have a great feel on how do we strengthen the public health infrastructure and prepare us for something like this that happens in the future.
The importance of county government is that we are key connectors to resources, and we want to make sure that all of our residents, regardless of whether they are in a rural area or a large urban area, know what resources that are available in their county, whether it's financial, whether it's housing, whatever it may be. You can contact your local commissioners to make sure that you know what accesses that are available to you.
County government is important because counties don't create jobs, businesses do. But counties can create an area where businesses can thrive, and that is one of the most important things that county commissioners can do.
I think county government affects the citizens more so than any other form of government, primarily because of the things that we are responsible for. Health and Human Services, our parks and recreation, Department of Social Services. There are just so many things that directly affect the citizens of Mecklenburg County or our county, such that county government is essential.
County government is here to serve our community. We're the boots on the ground. Where the state determines policy in Ohio, the county government is the one that carries it out.
County government is where the rubber meets the road. All that we do, all that happens in your day-to-day life is the result of counties. Federals have a job to play, municipals have a job to play, but at the end of the day, it is the county government that makes sure you get what you need. That's why it was so vital for the ARPA money to be paid directly to counties, because that's where the real action happens. That's where the support comes for all the programs that make people's lives better, that help our residents to not only to grow, but to thrive and then to rise. County government is the heart of America.